Welcome, everyone, both the organizers and the participants. My name is Adam Galgoczi. I am a physical therapist and neuro-hydrotherapist. And I would like to speak about the application of this system for CMT. Now, this is a therapy that does not replace either gym-based physiotherapy or home exercise. It is in addition to those two factors. Now, in general, neuro-hydrotherapy was elaborated by Dr. Judit Schultheisz decades ago, and Hungary has become one of the countries applying this system based on a scientific approach. It focuses on vestibular somatic stimulus therapy, and it has a complex system of maneuvers applied by the professional. Of course, the system is based on the recommendations of the actual physicians suggesting therapy for the patients. Now, we're talking about rare genetic diseases, and it is important that we always provide this therapy on the basis of recommendations made by those treating the patients in the first stage. Now, there are two stages. Individual treatment is provided in a tub for children in 20 steps, about 20 minutes. Neuro-hydrotherapy 1 is applied to children, newborn infants up to age 20 to 24 weeks. And then later on, at a later age, the therapy is provided in a pool instead of in a tub. We provide a whole set of devices that the professional can use with the children. And if you've never seen this before, neuro-hydrotherapy 1 is shown on these pictures. These are some of the maneuvers that the therapist uses to correct the bodily position and movement of the child. Now, it is very important to speak that we're talking about some patients who are at a high risk of health issues in the future, and we focus on two pieces of legislation. One is specifically for very young children, and the other one is for patients with spinal muscular atrophy. Now, there is always a window of time, a time window when children can be provided with this therapy. That's once again age 0 to 24 weeks. And then the second stage is after that. Typically, we're talking about weekly visits, but some children obviously cannot travel every week, or maybe the therapy requires more intensive therapy. Then we can provide HIT, weekly intensive therapy. So our center is not only providing training to therapists, but also provide functions as a knowledge base, knowledge center to provide support to professionals across the country. Now, differentiated diagnostics is never easy with CMT. And the more specific your diagnosis is, the more you can define your therapeutic objectives. And we use Gézengúz model, which is our modular system to provide physiotherapy both in the gym and in water. And we actually have a center in Budakalász called Cseppek Háza, the house of droplets, which also means the house of little ones, tiny ones, where patients can participate in parallel therapies at the same time, within the same time span, always with a view to their physical condition, their fatigue, the importance of rest time, because sometimes patients need different types of therapy provided at different locations, involving a lot of travel, and that can be overbearing. That could be too much of a load. So it's much better to provide different types of training in the same center. Sometimes the patients have enough communication skills to tell us how they feel. Like this child on the previous picture was actually hiding under that sphere, which is okay. We told them that they can do that, and then that allowed them some private moments and then relieve their tension and then continue to cooperate. So this is perfect. Now, water is your friend because it provides buoyancy to your body, and you can preserve your balance much better. Balance issues are a major problem with CMT, and improving your balance skills is not only the basis for finding the right equipment and braces and whatever. It is also important to improve the body's ability to sustain itself, support itself. We also provide help in improving the musculature of the patients. Now, we work primarily with children aged 0 to 3. And some of the tools we use, the devices we use, help spinal rotation and mobilization of children's spines. We focus heavily on preventing scoliosis, and we also focus heavily on the functionality of the extremities, especially the minor joints in the foot and hand. Of course, these problems will become part of how the patient sees themselves. And the physiotherapist must be aware of the psychology of the child, the character of the child, and we need to be able to tell what needs to be strengthened, reinforced, how we can plan the mobility development of the child. Just an example, we have children with arthrodiffusis who have an issue with daily personal hygiene. They cannot solve some challenges, and they don't know how to solve those challenges. Kids often rely on others to do their basic personal hygiene tasks. But interestingly, if you let them to their own devices, they often find ways to take care of themselves. And this is a healthy tendency that you should support. And moving around in the water is an ideal basically approach to that, because it helps children verticalize, by which we mean they learn how to stay straight up, stay erect, and that genuinely and generally helps their musculature and control and balance. Of course, if they have progressive scoliosis, this still helps. We prepare children to learn how to sustain their bodies. We try to help them strengthen their grip, which is a major factor in their autonomy. And of course, we can also help their lower extremity functions. They may not be able to actually walk on dry land, but they are able to learn how to walk in water, which gives them both motivation, the joy of moving, and also gives them an insight into how they could start walking in the gym on dry land. Let me give you some photos about this. We have platforms that you can adjust to various levels. Basically, you can regulate how deep the child is submerged in water. You can provide them with grabbing opportunities. We can use orthesis, braces to support them. And they first experience how they can manage their bodies, navigate their bodies around in water against the buoyancy of water. And they can actually start walking on top of these platforms, which will be extremely handy when we start walking on dry land. Now, these children often, even if they are given a few minutes of break time, they often stay standing because they so much enjoy standing for a change. So floating around in water is also something that generates a sense of freedom, and you can still provide them with corrective maneuvers and actions, something you cannot do on dry land, you cannot do out of the water. And for them to experience their autonomy in water is extremely powerful as an experience. Let me show you a couple of devices we use. These are flotation devices of various types. Water is in itself a sensory environment, but we also apply additional sensory devices to enrich their experience. Now, neuro-hydrotherapy is something that is the first step they can take out of hospital and into a wider world. So that helps children's ability to develop their own movement. We provide them with an opportunity to experience joy. Children love participating in these trainings. Initially, they are maybe concerned. This is a new environment, but it's a regressive environment, stress-free, and their involvement is based on their choice to become involved. And of course, this also helps them adapt to life in general, because we provide group training sessions that also helps them psychosociologically. Now, neuro-hydrotherapy is something based on children's joy. Kids love participating. Parents experience that their children enjoy these sessions, and that actually improves parents' ability to generate a different attitude, a more positive attitude to caring for their children. And may I introduce Boulevard Benny, our mascot. Children can just give a hug to, but we also use this puppet as our interpreter, because sometimes words just don't work well enough. This applies both to parents and children. Both parents and children have coping strategies, and it's important that children hang around in water throughout their lives, because it gives them freedom. It also helps them get used to regular movement, regular exercise, which will be a permanent part of their lives. We also think that communication between various disciplines, between various organizations working with the same patients is extremely important. We need to exchange ideas. We need to make sure that the specialist physicians also receive our input. And I think that Hungary's healthcare system is heavily fragmented as in terms of treating children. I think NHT can be used as a pure method for kids aged 0 to 3 years of age. Later on, it's an additional. We use Madrigal's ring methodology. We use Halliwick therapy, the Badrager's ring system, and swimming. All these techniques will be explained by my colleague, who will also present. And the device you see on the photo now is also an invention by the original developer of the methodology, and it's extremely useful in a spa setting as well. And on that note, I would like to say thank you for your attention.